I am the grandmother of Albin. Everything that happened before Albin got his diagnosis did exhaust everybody around Albin, and his parents are too tired, so I am the one telling his story. When Albin was 3 months old, we started to really think that there was something wrong with Albin. I went with my daughter and Albin to the child care center and talked to the nurse there and asked if we could see a doctor, but she didn't think it was necessary. She was really concerned about Albin's weight, but otherwise she didn't think anything was wrong. My first reaction to all this was that it's strange that nobody knew anything about what could be wrong. They must have been used to children with special needs, but nobody knew what it was. And that's when this terrible journey started.
MCT8 deficiency is a rare genetic disorder due to defective thyroid hormone transport across the plasma membrane with severe neurological and metabolic consequences. It's an X-linked disorder implicating that mainly males are affected. Symptoms typically start during the first months of life, but it usually takes a little while before they are recognized as due to MCT8 deficiency.
After I had insisted several times, we finally got to see a doctor, but he didn't know what was wrong with Albin, and I couldn't understand that. Albin was still an infant, and it was clear that he wasn't developing like other babies. Eventually we got to see another doctor, but he didn't know anything as well. 7 months passed without anything was clarified. My feeling was that they were looking in the wrong place, and as the month passed and Albin grew, we still didn't have a clue what was wrong with him.
So we typically distinguish between two components of this disease. Tissues that are dependent on MCT8 for their intracellular thyroid hormone bioavailability and will be deprived of thyroid hormone if MCT8 is defective. And that results in a hypothyroid state in tissues such as the brain, with consequences for neurodevelopment. At the same time, the high concentrations of circulating T3, the active form of thyroid hormone, results in thyroid toxicity in tissues that are not dependent on MCT8 but on other transporters for the thyroid hormone supply. And together this causes substantial morbidity and also mortality in these patients.
We were losing Albin's infancy because of lack of understanding what was wrong with him. After 3 doctors and 7 months, we finally got to see a neurologist. And at the same time, Albin was getting worse. He started to having cramps. The situation was going really bad. We had high hopes when we met the neurologist.
Typical symptoms in these patients are hypertonia and dystonia, and most patients are unable to walk or to sit independently. Also, body weight for age deteriorates over time, and there are also a number of cardiovascular problems.
When the result came back that the neurologist had taken, he didn't understand the results. But he knew somebody that maybe would understand it, so he contacted an endocrinologist, and he saw things from a different view. Albin was now 11 months old, and he still couldn't hold his head up and still couldn't sit or crawl, and he's such a sweet character, so it's difficult to understand that something is wrong with him.
Patients with MCT8 deficiency have a typical biochemical fingerprint consisting of normal TSH concentrations, low or low normal free T4 concentrations, and elevated T3 concentrations. So measuring those thyroid function tests will certainly accelerate the diagnosis. For confirmation of this disorder, a genetic test is needed.
When Albin was about 1 year old, he finally got his diagnosis MCT8 deficiency. And we started to understand more about his difficulties. And even if Albin needs care the rest of his life, we can now understand how we can do life much better for him.
Establishing the correct diagnosis is essential for a proper treatment. So at present we are exploring treatment possibilities for patients with MCT8 deficiency, and we hope that in the future lives of these individuals will improve.
Being a nurse myself, I still haven't met anyone in the line of duty that knows anything about MCT8 deficiency. Just imagine if more people knew how easy it is to diagnose it. It's just a simple blood test, and that would be magical. More boys like my grandson wouldn't have to suffer.